Okay, so today we're going to talk about chapter 42, which is sonographic and Doppler evaluation of the female pelvis. When we do a gynecological exam, there's a couple of things that we want to do before we do the exam. First is make sure the patient is prepped for the exam and also take a history. So I ask my patients, a huge thing that we can ask them is, when was your last menstrual period? Because that's going to determine how, if the endometrium, how thick it is, or how the ovaries look. I also ask if they've been pregnant before, which is gravity, and parity is how many deliveries they had. If they are on hormone regimen, if they have postmenopausal, sometimes they will put you on estrogen, which can change what the endometrium looks like. What kind of symptoms they're having is a huge one. If they have any family history of any kind of ovarian or uterine cancer, any pelvic surgeries. There has been times when someone does not tell me that they are missing a right ovary, and I'm looking, I'm like, I cannot find this ovary. And then they're like, oh yeah, I had that taken out a long time ago. It's like, okay, thank you. If they've had any lab tests, previous Pap or biopsy results, and if they've had a previous pelvic exam, because we would want to compare the findings from this exam to that exam. So usually the exam is performed in two parts. There's a transabdominal approach where the transducer is carefully scanned across the lower abdomen. And there's a transvaginal approach, which is an internal ultrasound, similar to a pelvic exam. This is a transabdominal ultrasound. This is what you're going to think about. This is what you're doing in labs right now, where you're scanning on top of the belly and we're looking for the uterus and ovaries there. And this is a great way to get an overall, like a global view of the pelvis. This is a transvaginal ultrasound. So the probe goes into the vagina a little ways, and it's like a camera getting very close to the uterus and the ovaries, like a pelvic exam. And we actually have a model like this on the right that you can practice transvaginal scan in the lab. So you kind of know how to move and orient the probe before you get into clinicals. So for a pelvic ultrasound exam, we're looking for the vagina and the uterus are going to be our main anatomical landmarks. We're going to document the uterine size, shape, and orientation. So we're going to see how big it is, if it looks normal, if it's anteverted or retroverted is what it means by orientation, the endometrium, the myometrium, and the cervix. And the vagina serves as a landmark for the cervix in the lower uterine segment. I'm going to measure the uterus from the fundus to the cervix on the uterus and do an anterior to posterior depth measure and long. We also do width. So the three measurements that you do for the uterus are the length, the AP diameter, and the width. Know those. Sometimes we'll do cervical diameters with pregnancy if they are pregnant. The endometrium is also analyzed for thickness and echogenicity. So we'll measure the endometrium in an anterior to posterior measurement, so AP. And then we're going to look at the myometrium to make sure that the contour is fine, there's no masses, and the echogenicity looks good. For the next, we're going to look at the ovaries. We're going to document the size, shape, and contour, the position relative to the uterus, and the ovarian size, determined by measuring length of long axis with AP dimension and the width. So for the ovary, we're going to measure the length of the ovary, the AP diameter of the ovary, and the width of the ovary, just like we did for the uterus. So you're going to do 3 measurements for each. When we do that, ovarian volume is calculated from the computer, so it can kind of tell us if it's within range or too big or too small. We also evaluate the cul-de-sac for fluid. If there is a mass detected, we document the size, the position, shape, and what it looks like in relationship to the ovary and uterus. So this is what I was talking about transabdominally. On the left is what it would look like if we had cut that woman in half again and we're looking inside. So the transducer is going to be on top of the tummy in the pelvic area. And then this is the bladder. The bladder we need full because it acts as an acoustic window for us so that we can see inside the uterus. If the bladder is not full, the uterus is laying down on the bladder. There's a lot of bowel and it's really difficult to see. And then below the bladder is the uterus here. So on the screen, you're going to see the anterior portion is going to be the top of the patient. Just getting my thing here. So this correlates to this. So that's how, that's the anterior, and then you can see the bladder here. This is what it's going to look like on ultrasound. And then you can see the uterus here. That's what it's going to look like. When we're measuring the uterus, what in the length, you're going to measure from the fundus, which is the top portion of the uterus, which we talked about last chapter, to the cervix. And of course, we're going to have a better line than my squiggly little line there. So that's going to be your length. And then you're going to do an anterior posterior diameter, which is going to be here to here. And this is in a sagittal view. So this is the sagittal view. The sagittal means that the probe is going to be long. When a mass is found on the sonography, you want to characterize the location, size. If it's well defined, it'll define irregular borders and the internal consistency, cystic complex, predominantly cystic, solid, which I'll talk about as we continue to go on. This is a true ultrasound picture of what a beautiful long uterus would look like. And you can see that they have measured the length from these two little cursors, so from the fundus to the cervix. Right here is the vagina. So the vagina comes to the cervix here, and then it goes up. This is an anteverted uterus, so this is a normal position of a uterus to the fundus, and then an AP diameter. This black hole here, this is the bladder. So this is a very, very full bladder. This is a transabdominal approach. So again, if you were thinking, how would you measure it in length? You would measure it like this. So that's from the fundus to the cervix there, and then an AP diameter. The orientation is going to be, this is going to be anterior. This is going to be posterior. This is going to be towards the patient's head. I don't have my pen, and so it's being crazy, but this is the head, and then this is the feet. It's like a leg. And so that's how the orientation is. Sorry for all those lines there. But I'll erase it all here. So head, this is the feet, head, anterior, posterior. And that is how the orientation is. And that's how it's going to be a lot of the times, even with your transabdominal, your vascular that you're going to do, your abdomens are all going to be the same orientation most of the time in a sagittal view. And this is what it looks like without all my crazy red lines. So cranial and caudal. Cranial and caudal is another thing for towards the cranium. Caudal is towards the feet. This is measuring the uterus again. I feel like I'm kind of keep pushing this, but it's like the first thing that you're going to want to measure. So what is this black hole? The bladder. And how are we going to measure the uterus? We're going to measure it from the fundus to the cervix and from the anterior to the posterior part of the uterus here. And then we are going to do a width measurement of the uterus here. And this is in transvaginal. Transvaginal. This is in a sagittal view. So when we're doing a transabdominal pelvic protocol, we're going to look midline first. So we're going to do a midline uterus, and this will give us a good image of, this would be a good picture. This would be a good picture of your first picture. And this is going to give us a good midline of the bladder, the uterus, the cervix, the vagina. It's a good place to start. And then we'll measure from fundus to cervix, measure AP, anterior, posterior. Then we're going to angle right, and we're going to go towards the right uterus, out to the ovary, and then we're going to go angle left, and we're going to go out to the left side of the uterus. What we're doing here is we're looking for any kind of fibroids or masses, and that's all you do at first. And then you're going to go to a transverse view, and then you're going to go to the urinary bladder, vagina, and cervix. Then you're going to go up mid to the body and endometrium, look for ovaries, and then high into that fundus. So you're kind of cutting through the uterus and taking pictures as you go. And I usually recommend taking 4 pictures. And I will also put a protocol, our Newman protocol, on your module this week so you can take a look at what we like to do. Once I look at the uterus and I've gone long and I've gone transverse, I'll go back and I'll start looking for the ovaries. So the ovaries are very difficult to see in transabdominal because they're such a small, they're only 3 centimeters, they're almond shaped. There's a lot of bowel. So they're a lot easier to see in transvaginal, but we do try to give it a good look if we're going to be doing transabdominal. So we're going to go to the right ovary here, and we're going to do a long measurement of the right ovary. We're going to evaluate the right ovary to make sure there's no masses, cysts, anything going on. So we'll do a length, an AP diameter, and we will put some color on the ovary to make sure that there's vascular flow because it's very important. Then we're going to turn transverse it on the ovary, and we are going to take a width measurement at that time. And we're going to scan through there just to make sure that there's, again, no masses. We're looking at the entire ovary. Then you'll go to the right adnexa and just make sure there's no fluid or an adnexal mass that's outside of the ovary. This is an ovary right here. So you can see how they're measuring. Look how little they are in transabdominal. Kind of difficult to see, but they're not impossible. So this is the right ovary, and it's measuring from the length and the AP diameter. And this is the left ovary, and it's measuring from the length to the AP diameter. Okay. This is a transverse view of the uterus. And so when you are scanning through the uterus, you're going to do a width measurement. That's terrible width measurement. The width is going to be a straight line if I can do it across the fundus there, as you can see right here. This white arrows here are pointing to the endometrium, which you will also evaluate. So you will also be measuring the endometrium. So you measure the AP diameter of the endometrium. So it's that white part that you see in each one of these images. It's this one right here. And on a real machine, when you're really doing it, it will tell you how thick it is. So then you can kind of put in your brain, is that too thick for this part of your cycle? Like a thin one right here. So she must have got off a period. And that's how you do it. So that's kind of a little bit of an overview of the transabdominal. Now, when we are in class, I will show you how to do an ultrasound, even transabdominal, and what the protocol looks like too. So to give you a little bit more of a overview. So I think for this video, that's all we're going to do. See ya.